Hi, this is my Alginate impression eval. The PPE you would need for this would be gloves, mask, and glasses. And the materials you'd need would be Alginate powder, a rubber mixing bowl, room temperature water, spatula, maxillary and mandibular trays, proper measuring tools, a mouth mirror, a bag with the patient's name and date on it, and then disinfectant. So first, when you seat your patient, you want to adjust the headrest and give them a patient bib and safety glasses. You want to explain to them the procedure that you're going to take an Alginate impression of their mouth so that you can have imprints of their top and bottom teeth. You want to examine their mouth for any abnormalities or removable appliances, and then examine their maxillary and mandibular arches to see what size tray you need. When you're mixing the Alginate powder, for the mandibular tray, it's a 2-to-2 ratio, so 2 measurements of water and 2 measurements of your Alginate powder. And for maxillary, it's a 3-to-3 ratio. First, you want to fluff your powder, and then you would place your water in your rubber bowl first. So you do 2 measurements of water if you were doing a mandibular tray, and 2 scoops of your powder. Then you want to take your spatula and mix for 30 to 45 seconds to give it the right consistency. And halfway through, you want to wipe your spatula off to make sure you're mixing the material correctly. And when that is mixed, you can fill your trays. For the mandibular tray, you're going to take half of the mix and put it in one side of the tray, and then the other half would go on the other side. And for the maxillary tray, you want to fill the whole thing with the bulk of the material towards the anterior portion. And when you have them both filled, you want to dip your fingers in water and run your hands over your fingers over the impressions to make grooves.